Welcome students. Today we are going to study about anatomy of uterus. So here you can see this is the uterus, which is the main part of reproductive system of females. Uterus is also called womb in layman terms and also hyster. And because of this name hyster, the surgery in which we remove this uterus is called hysterectomy. Okay, so we have got now three names: uterus, womb, hyster. Okay, now next thing that we should know is what is the position. Obviously, just like fallopian tube, ovary, uterus is also a pelvic organ, and it is lying between the urinary bladder and rectum. That means anterior to the uterus is urinary bladder and posterior to it is rectum. So this is lying in between. So next thing that we should know is dimension. What are the dimension? Now I will recommend you to remember just one number, 2.5. Okay, so it is 2.5 centimeters thick. How much thick? 2.5 centimeters. Now add 2.5 in it, means make it double. What it becomes? 5. So it is 5 centimeters broad. Okay, again add 2.5 centimeters, it becomes 7.5. So it is 7.5 centimeters long. Okay, so just remember one figure, 2.5. Go on adding 2.5 to it again and again. So 2.5 centimeters thick, 5 centimeters broad, 7.5 centimeters long. So you have understood the dimension. Now parts of uterus. You can see here it is uterus is broad above and narrow below. So for broadly it is divided into two parts. Upper part is called the body. The lower part is called cervix. Clear? So this is cervix, the narrow part which is projecting in the vagina. This is vagina. This is called cervix, and the upper part is body. And in body also, it is further divided into fundus. So this upper part is called fundus of uterus, and this is the lower part of body of uterus. And you can see this is the cut section, and this is the myometrium, and this is myometrium made up of muscles, and this is endometrium. Endometrium, which is under the influence of hormones. So it is having two phases. One is proliferative phase, means it is going to proliferate. It will increase in number, it will increase in thickness when estrogen cycle is going on, means 14 days before the ovulation. But after ovulation, progesterone takes over. From the corpus luteum, progesterone is being secreted. So progesterone will increase the secretions of uterine glands, and so the second phase is called secretory phase. And suppose fertilization does not occur, what will happen? The whole endometrium will shed off and it will be removed through the vagina, and that period will be called menstruation. So this is the whole menstrual cycle. And suppose implantation takes place, the fertilization takes place, implantation will take place in the posterior surface of fundus. Clear? Now, as we can see in this diagram, everything looks straight. It is not so in the body. It is folded like this. First fold is between vagina, axis of vagina and axis of uterus. So the first fold, suppose this is vagina, this is its axis, then the next, this axis will be of the uterus. So this angle, it is folded forwards. So this difference, the angle between the axis of uterus and axis of vagina is called anteversion if it is folded forwards, which is most common position. Then the body of uterus, suppose this is the body of uterus, its axis is also folded on itself like this, and this is called anteflexion. And suppose it is in the opposite direction, we will call retroverted retroversion. Okay, so this position of anteflexion, anteversion is very important in preventing the prolapse, and so it is giving the support to the uterus. So it is this axis of uterus is also one of the factor which is giving support to uterus. So you have understood about it. So you know what is in front of uterus, it is the bladder, and what is behind, it is rectum, and what is behind the rectum, sacrum, isn't it, sacral vertebrae. So this much you have understood. Now we talk about the ligament. See, peritoneal ligaments are there and fibromuscular ligaments are there. Peritoneal ligament, the largest one is called broad ligament, means there is a fold of peritoneum which is just like a curtain lying over this uterus along with the fallopian tube and ovary. So if this happens, what will be the contents of broad ligament? Contents of broad ligament will be fallopian tube, ovary, this ovarian ligament, and behind the ovarian ligament is uterine round ligament of uterus or uterine ligament. Then there will be uterine artery here, so that will be also lying inside the broad ligament. Then ovarian artery, that will also be lying within the broad ligament. And when artery is there, veins have to be there. So definitely the counterpart of these arteries, the veins are also going to be there. Lymphatics will be there, because in every structure of our body, every part of our body, I have always stressed that it has to have arterial supply. If there is arterial supply, there should be venous drainage. And when these two are there, there has to be some lymph produced, and so lymphatic drainage will also be there, and nervous system will be there. Okay, some nerves will be there. Without sensation and or activity, how it can happen? So same way here in the broad ligament, we will find artery, uterine artery, ovarian artery, counterpart of the both arteries, the veins, the lymphatics of both the areas, then the nerves, plexus, nerve plexus, sympathetic as well as parasympathetic, because ovary also had both sympathetic and parasympathetic nerve supply. Fallopian tube had parasympathetic and sympathetic nerve supply. Similarly, the uterus will also have sympathetic and parasympathetic nerve supply. So the nerve plexus will also be present in the broad ligament. So these are the contents of broad ligament. So broad ligament is nothing but a large fold of peritoneum which is covering like a curtain all these structures that we are seeing here. It is just covering it like this. Understand? So everything which is coming inside is the content. There are two more contents of which you cannot see in this diagram, and they are nothing but embryonic remnants. So that is apophoron and paraphoron. When we will study embryology, you will understand these are nothing but the parts of embryonic tubes which were destined to form the male reproductive organs, and since this person became female, so the female reproductive organs developed, and all the structures which were destined, which could have formed the male reproductive organs, they all disintegrate. But when they disintegrate, some parts are left, and two parts which are left here, they are present here in the broad ligament, apophoron and periphoron. Okay, so these are the contents of broad ligament. Now, if you can see, the cavity of uterus is triangular in shape, and when we see the cervix, here we will see a narrowing, again a narrowing, and there is a canal. This is called canal. Okay, and this portion, if you see the whole uterus and this is the cervix, this appears to be a little narrow portion. A narrow portion is always called isthmus, and this opening of the internal opening of the cervix is called internal os. Os is opening, mouth, and this outer opening is called external os, which opens in the vagina. And you can see here the cervix is protruding in the vaginal cavity, and there is a gap between vagina and cervix. This gap between vagina and cervix you can see all around. Here you can see two sides, but if you imagine the 3D picture, it is going to be present all around. So this gap between the vagina and cervix is called fornix. Okay, and because we have got a gap anteriorly, we have got posteriorly, we have got on both sides, they are called fornices. So anterior, posterior and lateral vaginal fornices are present. So this is all about the uterus. Now the main thing is the support of uterus. What are the supports of uterus? Peritoneal supports of uterus are very, you can say they are not very strong. So they are present, but they are not really supporting it. But still we take them as supports of uterus. So peritoneal support of uterus, first is the broad ligament that you saw. That was the biggest of the peritoneal fold. Then there will be an anterior fold that is between uterus and bladder. So that is vesico-uterine fold or anterior uterine ligament. That is also peritoneal. So it is not really giving much support. One is posteriorly. So posteriorly what will be present? This vagina is quite high up because I said it is folded like this. So the posteriorly the vagina is quite high up. So the fold is, peritoneal fold is between the vagina and the rectum. So recto-vaginal fold or posterior uterine ligament. This is also a peritoneal ligament which is giving support, but as I have said, all these three are peritoneal ligaments which do not really give support. Okay, the real support is given by structures which are strong, muscular. Okay, so first is muscular structure present in the perineum. So perineum means below, isn't it? Near the outlet of pelvis. So that is pelvic diaphragm, and all the muscles of the pelvic diaphragm are attached to the perineal body. So the second structure is perineal body, and then the muscles forming the peripheral or the distal urethral sphincter. These three structures forming the floor of the pelvic diaphragm or the pelvic diaphragm are giving the main support. Apart from this, other fibromuscular supports are number one is uterine axis itself. As I have told you, it is anteverted and anti-flexed. So that is the first support. Okay, the second support is going to be given by the uterine ligament or round ligament of uterus. As you can see, here is the ovarian ligament. This is present posterior inferior to this fallopian tube. Anterior inferior to it means this is slightly posterior, this next ligament will be slightly anterior. That is uterine ligament or round ligament of uterus. So that is the first ligament, which is fibromuscular in nature, which is giving support to the uterus. So that is giving the support. The next two are going to be arising from the cervix. Cervix first is going to be the anterior. So the anterior ligament or the pubocervical ligament. Another will be the transverse cervical ligament or ligament of Meckenrod. So these two ligaments from the cervix and this ligament from the uterus along with the uterine axis, these are the main supports of uterus. So fibromuscular ligaments, axis of uterine axis, pelvic diaphragm, with all the three structures which are forming the pelvic diaphragm, these are the real main supports of uterus. Now, like all structures, we have to talk about the blood supply. We have already said the arteries which are present in the broad ligament, they are going to supply the arterial blood. So uterine artery, ovarian artery, both are going to supply the blood. And similarly, counterpart veins are going to drain it. Lymphatics. Now in lymphatics we have got a little distortion. Why? Because the upper part of fundus, because it is related to the fallopian tube, related to the ovary, so the upper part of the body and fundus, they are going to drain in the same lymph nodes where these structures are draining. That means the aortic lymph nodes. But the lower part, they are going to lower part of the body, because it is now related to the round ligament of uterus. So it is going to drain in the superficial inguinal lymph nodes. Remember, inguinal lymph nodes are the lymph nodes which are present just below the inguinal ligament in the lower limb. Okay? But the vaginal, the cervical region and the lower portion of the body, they are going to drain in the lymph nodes related to external iliac vessels, internal iliac vessels. So here the iliac vessels, iliac lymph nodes, you can say external iliac, internal iliac lymph nodes, here they are going to drain. The nerve supply, sympathetic, parasympathetic. And now the applied anatomy, as you know, first is the menstrual cycle that you have to talk about. Second, it is the womb, so it is going to carry the fetus. So it is related to the development of fetus, and the parturition is the word which is related to the delivery, when the fetus is delivered out after maturation. That is called parturition. Then the removal of the uterus is called hysterectomy. It can be because of any other reason. Maybe a tumor will be there, benign tumor or malignant tumor or some other reason. Next, you can find bicarnuate uterus. Means here you can see a single uterus with a single triangular cavity. But if there is a dip here which can go down up to here, so we will have uterus almost bifurcating into two. That's bicarnuate uterus. Then sometimes uterus is not formed. The vagina is not formed. This whole area is not formed. And that is a very difficult situation which will be discussed later on when we talk about it in embryology. So I think you have understood about the anatomy of uterus and cervix. Thank you.